Channel. In this video, we will discuss antiphospholipid antibody syndrome. So, antiphospholipid antibody syndrome is an autoimmune disorder that is characterized by the antibodies against cardiolipin, that is anti-cardiolipin antibodies, anti-beta-2 glycoprotein 1 antibodies, and lupus anticoagulant. So, these antibodies are present in the antiphospholipid antibody syndrome. It is a condition in which there is arterial or venous occlusions and pregnancy complications. Pregnancy complications such as pregnancy loss, before 10 weeks of gestation. Signs and symptoms of antiphospholipid antibody syndrome are: initially it is asymptomatic until a thrombotic event happens. It may be in the form of pregnancy loss, or it may be a thrombotic event like deep venous thrombosis, pulmonary emboli, stroke, Budd-Chiari syndrome, that is thrombosis of the hepatic vein, DVST, deep venous sinus thrombosis, myocardial infarction, digital infarcts, adrenal gland infarcts, mental status changes. You should know that adrenal gland infarcts are actually hemorrhagic infarcts, which are venous infarcts. Mental status changes, libido reticularis, that are web-like blood vessels that are pinkish in color appearing on the skin. Then skin ulcers. Nephropathy can also occur, and cardiac vegetations and cardiac valvular disease can also occur. In pregnancy, there are 3 or more unexplained miscarriages before 10 weeks of gestation, raised to suspicion of antiphospholipid antibody syndrome. When we do labs, then we do CBC that may show anemia and also shows thrombocytopenia. Furthermore, we can detect anti-cardiolipin antibodies, anti-beta-2 glycoprotein antibody levels, and lupus anticoagulant by using Russell Viper venom test. Treatment of antiphospholipid antibody syndrome is: we should maintain an INR of 2 to 3, and for this we first choose low molecular weight heparin, for example enoxaparin, and along with it we use warfarin to increase the INR to 2 to 3 to reduce the thrombosis. For pregnancy, we use low molecular weight heparin plus aspirin. Aspirin is at 1 milligram per oral per day, once a day. And as warfarin is contraindicated in this pregnancy, so it can't be used. For severe antiphospholipid antibody syndrome, we use intravenous immunoglobulins or plasmapheresis along with intravenous heparin and corticosteroids. And for recurrent events, we use this warfarin for whole life sometimes.